Thank you very much, Ellen, and thank you very much as well to everybody who's tuning in tonight on a very rare good weather evening. The sun is just setting, so thanks very much for tuning in. So as Ellen said, I'm going to be talking about mobility matters tonight and how we can tackle lameness in the dairy herd. Now, I've been asked to cover that in an hour, which is quite a tough task for me because I actually spend all of my time talking about feet. So I'm a farm animal vet. I graduated just over 15 years ago now. And around 6.5 years ago now, I moved back to Cowbridge in the Vale of Glamorgan, which is where I was brought up. And since then, I've focused more and more on feet. So now 100% of my time is spent talking about lameness, trimming feet, treating feet, doing research into foot bathing products and treatments, etc. And I also have a special interest in foot trimming technique, and I'm currently doing a PhD with AHDB on that topic too. And we're due to start some very exciting fieldwork here in South Wales early next year. So the aim really of the next hour is just to get you thinking. I cannot give you all the answers in the next hour, but I want to just give you a few sort of tips and hints about maybe what you need to start looking for when you're trying to tackle lameness in your own herds. And as Ellen said, we've got some follow-on workshops from here where we'll delve into some of these lesions in a little bit more detail. Now, I know that some of you might have poor internet speed, so I'm going to turn off my video now, but I'll pop back up for when we have questions later on. And as Ellen said, pop those questions as we go along in the Q&A box and we can have a good discussion as we go through. So to make a start with what I want to cover this evening, I want to talk about why we need to do better with lameness. Why are we all tuning in tonight to talk about lameness? And then how do we do better? We need to be doing better. So what do we need to do to get better at lameness and reduce the lameness levels that we've got? So we need to really be talking about improving detection. We're not very good at detecting our lame cows early enough. So how do we get better? Then obviously, once we've detected a lame cow, we've got to treat them. We need, it's time and energy and cost to treat these animals. So let's make sure that all of that investment is going to yield you the best result. And then obviously prevention is better than cure. So how do we go about preventing these lameness cases in the first instance? So let's start off by thinking about why we need to do better when it comes to lameness. And I've got some questions for you, just some poll questions, just to keep this as interactive as possible as we go through. So my first poll question for you this evening is, what do you think the average level of lameness is in the UK dairy herd? So do you think that it's less than 10%? Do you think that it's between 10 and 20%? Do you think that it's 20 to 30%? Or do you think that it's more than 30%? And you should have now had a box that's popped up on your screen there, and you simply select A, B, C, or D. So what proportion of our cows are lame at any given time? Is it less than 10, 10 to 20, 20 to 30, more than 30? And we're currently quite split evenly over the answers. So I'm just going to give you the final few, just a few more seconds to think about it. Okay, and we'll close the polling there. So the answers that we had were 20% of you going for less than 10%. Then we had 30% going for both B and C, and then 20% going for answer D, which is more than 30% of our herd being lame. And actually those that selected for D are correct, because in actual fact, more than 30% of our herd, so the latest research shows that around 32% of cows are lame at any one time. So this means that 1 in 3 cows is lame at any given time across the UK. And that's obviously a real concern, because this means that 1 in 3 cows is in chronic pain at any given time. And that's something we really need to rectify. We don't want these animals to be lame, obviously. So we need to work about how we go about improving that. Now, a lot of energy has been put into lameness in the last 20 years. So how do you think this figure of 1 in 3 cows lame at any one time compares to 20 years ago? Do you think that we've definitely got better? Do you think we're about the same? Or do you think that we've actually got worse in the last 20 years? So again, you should have a poll question popping up now. So how do you think we compare to 20 years ago? Are we definitely better than we were then? Did we have more lame cows kicking around 20 years ago? Are we about the same, or do you think we've got worse? Okay, a few more to vote. Just give you a couple more seconds. Okay, so we've got there, the winner there is 40% for going for B, which is about the same. And then we had a split for the remainder going for either definitely better or worse. And it's a bit of a trick question because we don't actually have reliable data to go on to base this on. So we think that probably we're about the same because we don't have any data to show that we've got better. We don't have any data to show that we've got worse. And all of the results that have been done looking at herd prevalence across the UK has all come out at around 30%. So really, we think we're probably about the same. Now, is that good enough really in 20 years that we haven't made any improvement? And certainly it's something now that is really coming to the forefront. And obviously I'm biased. I spend my entire time in lameness and I've worked quite hard over the last few years to really try and raise this up the agenda. And finally now, actually lameness and all the discussions that are being had around cattle health and welfare, lameness is constantly coming out there as number one priority. It's also recently come out as the #1 priority for vets across the UK as well. So trying to work with both farmers and vets and the industry as a whole to try and reduce this level. And I really do feel that in Wales we are really well, that we can actually really drive this down as a country and really be one of the best in the world when it comes to lameness levels, because it's not just the UK that has a problem, it is a worldwide problem. And you know, there are countries out there that have over 60% on average lame, and there are some herds countries as well that are less than 10%, and that's what we really need to be aiming for. Because obviously this has a huge impact on the consumer, and one of my constant concerns is that, you know, we have a positive image currently. You know, people want to see cows out in the field, blue sky, walking well. But what we really need to avoid is this this image of these chronically lame cows hobbling over motorway bridges. There was a recent article in the press about a beef rearing unit and animals being lame and crippled, and that's something that really concerns me, and I think is a huge potential area that we could face criticism for within the industry. But obviously it has impacts on the cows. It's the most significant welfare issue affecting dairy cattle, considerable cause of pain, because obviously lameness is a sign of pain. And the problem with cows is they're very good at hiding pain. So actually by the time they've got a sore foot and they're lame, you know, actually we're quite late on into when that issue started happening. The most common cause of distress with 1 in 3 cows lame at any one time, and obviously this has an impact on milk yield and fertility too. So what about impact on you as the producers? Well, obviously it's a cost, and I'm very well aware that every vet that stands up in front of you will say, well, this disease has a cost and you are losing X amount of money, and if you solved all your problems you'd all be millionaires with the money you'd be saving. But lameness is much more costly than we think it is. But also I think one of the hidden costs that maybe we can't put a figure on is staff morale. Nobody likes seeing lame cows. And so this is an additional cost on top of the other costs that we traditionally associate with lameness, being reduced fertility and reduced yield. So another poll question for you. In Wales, how much do you think that lameness is costing our industry every year? Do you think that it's less than 20 million? Do you think it's 20 to 30 million? Do you think that it's 30 to 40 million? Or do you think that it's 40 to 50 or more than 50? So I'll just launch that poll there. So what do you think it's costing our industry every year? Okay, we had an initial clear winner, and now it's just changing. Just changing around. So I'll just give the last couple of you a chance to vote. Okay, then polling there. So you can see here that the winner with just over 50% of the vote was B, so 20 to 30 million. We then had a few going for 30 to 40 and a third of you going for 40 to 50. So I'll just stop sharing those results. Then the answer actually is more than £50 million. Now you might think that's absolutely crazy, but I'll just go through some back of fag packet calculations with you about how I come up with that cost. So we've just got over about 250,000 dairy cows based on the last figures in Wales. if we take an average of 30% lame at any given time, that roughly equates to 78 cases per 100 cows per year. If we put a really conservative cost of £300 per case in, then that means we've got over the 198,000 cases per year. This comes up to a cost of £59.5 million, which is quite substantial. When you break that down on average across every herd in Wales, that's quite a saving. So how does that compare? How does it compare to the other diseases which we've maybe focused on a little bit more in the past? So as I said, it's costing £59.5 million per year in Wales. We scale that up across the UK, it's £445 million. Clinical mastitis is costing 183 million, TB 44 million, and BVD 25 to 61. So you can see it stands out massively as this huge cost that we're missing a trick with, because actually we don't need to put a huge amount of investment to claw an awful lot of that back. And yes, a lot of these will be related to each other. So for instance, animals that have BVD might be more likely to go lame with a digital dermatitis infection, etc. We see it as well with TB sometimes, that those animals that are struggling are more likely to go lame. So all of these are quite interlinked, the same with clinical mastitis. So clinical mastitis cows are more likely to go lame as well. So everything is interlinked. However, it stands out as a big cost that we can start looking at how we can start reducing that across the entire herd. If we want to start putting figures to your own herds, then we can roughly break that down into a figure of £2.20 for every day that a cow is lame. So for instance, if you've got 100 cows in your herd, 30 are lame, that's a cost of 30 times so £2.20, so £66 a day that's costing you. So just think about some of the interventions that you could make that are relatively low cost that can start reducing that drain on the economics of the farm. So that's all good and well. You know, we know that lameness is costing us, we know that it's too high, but how do we actually improve that? How do we get better when it comes to lameness? Well, there are three things that we really need to do. So the first is that we need to improve recognition. We need to get better at detecting lame cows. And it is very, very difficult actually when you're surrounded by cows on your own farm, you know how they walk. It can be very, very difficult actually to pick up these subtle signs. I know I used to live on a dairy farm in Cheshire, and I would have the argument with the scorer, oh, well, she's always walked like that, or, you know, or how, you know, she's only walking like that today. So I think that maybe this is where we need to take a step back, and we need to look at how we can improve recognition even by bringing someone else in to help us to do that. Then we obviously need to know how we can improve treatment. So once we've picked up our lame cows, let's make sure that we treat them appropriately to get the best results that we can. And obviously then we come on to improving prevention. There is not scope in the next 45 minutes to go through all of these and give you all the answers. But I just want to, again, just give you some tips and thoughts really about how you can start implementing some of these things on your farms. So we start with improving recognition. Obviously, this comes down to mobility scoring. That's a bit of a buzzword. We've been using it for years, but it's still something that I don't think is utilised enough on a farm. We know that if you go out and you mobility score your cows fortnightly and you treat them all correctly, that within a couple of months, we can really hugely reduce the lameness on your farm. And if everybody did that and did nothing else, we would have a massive impact on lameness. So sometimes it's about overcoming the challenges that we have when it comes to mobility scoring, but it has loads of benefits. We can consistently benchmark your herd performance. So we can benchmark you against others. We can benchmark you in terms of seasonal effects and things as well. So for instance, a lot of my herds at the moment are seeing a slight increase in lameness because of the heat. So then we can start quantifying that, and we can start saying, right, okay, heat stress is always causing an increase in lameness at this time of year, or about 6 to 8 weeks after a period of heat stress. So what mitigating factors are there that we can put in place? What can we do? What are they going to cost? And what's the cost benefit? It's going to identify trends and patterns, as I just said, to identify the most cost beneficial control measures. And obviously it helps, and for me, this is the biggest thing about regular mobility scoring. It's the early detection, and the earlier we detect these animals, the more effective our treatment outcome is going to be. But obviously this all relies on us being able to identify cows early enough. So I'm sure that you're all familiar with the AHDB dairy mobility score. This was brought out around 13 years ago now, so it's been here for a long, long time. And it's basically just a 4-point scoring system where we go from score 0, which is our very good mobility animal, walking perfectly fine. Score 1, not lame, but we wouldn't say that she's walking as fluidly as a score 0 animal. Then we have our lameness categories, so score 2s and 3s. Now, everybody will be able to identify a score 3, but it's the score 2s that we really need to be focusing on. And for me, this is where we get the biggest wins. So detecting them at that early score 2 stage is really, really important. And it's about setting your threshold at a point where you're picking these lesions up just as they're forming, just as that animal is going lame. And so it's looking for these really, really early signs of lameness. So if we think about what the most useful signs to look for are in a lame cow, well, actually, if we think about all of the signs that a lame cow might show us when she is lame, there's a huge number. So I've got 18 listed here. We start with a limp or an uneven weight bearing. They might have an arched spine. Sometimes they have an arched spine when they're standing, sometimes just when they're walking. They might walk at a slower speed, stop frequently, have shortened strides. They might have a head nod as well, or put their foot out of sync, so they might not be tracking up. They might have an abnormal foot placement. Then we have things such as lower head carriage, difficulty turning and rising, standing up and shaking their legs because they're painful, might have a swinging leg, or a very, very stiff gait or knuckling. Now, some of these signs are really, really obvious. If she's like knuckling over on a foot, obviously we can identify that foot immediately. But what we really want to be looking for is those really, really early signs. So the signs that that cow is just starting to hurt. And those are the ones that, for me, are highlighted in red. So these are the ones that I look for. If I'm looking for an animal that's going to respond best to treatment, I'm looking for these signs that are highlighted in red. And you're all pushed for time. And I always think that we have only so many slots in the foot trimming crush a year. And so we need to make sure that the animals that go through that foot trimming crush are the ones that are going to benefit most from treatment. By the time she's been hobbling lame for quite a few months, we've lost it. We're not going to be able to, we've lost our chance to get her back. We're not going to have as much opportunity to get her walking right again. Whereas actual fact, the time it takes to treat one really chronically lame cow, we could probably do 3 early lame cows. So it's about using time, cost and energy most effectively for the best outcome for the herd. So the things I'm looking for, an uneven dew claw drop. So we've got the dew claws at the back of the foot. And when you look carefully at a lame cow, those dew claws on the lame leg don't go down to the floor as much as they would do on a sound leg. And that can be the very first sign that she's just starting to hurt, just starting to get bruising there in the foot. So that's a really early indicator, and that's something that can be quite tricky to pick up. If you've got anybody who's involved with horses on your farm, they tend to be very, very good at picking up these subtle signs. They might also have shortened strides. So this is where I'm looking at the back legs, so the back legs following through, and we've got even fluid strides. If we haven't, then there's probably a reason why. And again, the soft foot placement, and that links into this uneven dew draw clop. So if they're not wanting to put their weight fully through that leg, and this is where you tend to get the other leg swinging through a little bit more quickly, or that foot seems to be quite stiff when it goes down, then again, that can be a good sign that something is just starting to brew, and we need to get at it quickly. So, as I said, there's not scope to go through mobility scoring and all the different scores in this, but what I would do is encourage you all to get on a course or a workshop about scoring. Lots of them are happening virtually now, just to make sure that you're identifying those cows at that really early stage. Next time you've got the vet or you've got someone who's trained in mobility scoring on your farm, then ask just to watch a few cows and just compare notes. It's really important just to get your eye in with your own cows as well. So those are the early signs that we need to be looking for to make sure that we're picking up those cows at the right time. So the next question really is, how often should we score to detect early enough? What is early? And how should we treat these new cases? And I can really answer both of those questions through one study that was done on treatment. Again, this was University of Nottingham research, AHDB research. It was actually the previous PhD to mine, where they looked at treatment of claw horn lesions. So when I'm talking about claw horn lesions, I'm basically talking about lesions of the sole and the wall. So I'm talking about bruising like we have here on the left-hand side, sole ulcer, which is the central photograph, and then a really severe white line that we've got on the right-hand side there. So these are our clawhorn lesions. And basically what the Nottingham Study did was they randomly allocated new cases of lameness. So these were cows that had been sound for at least 6 weeks prior to their score, and then they came up with a new score too. They randomly allocated them to 4 different treatment groups. So the first treatment group was just a trim. The second treatment group was a trim plus a block. The third treatment group was trim plus a non-steroidal or a pain relief. So in this case, it was ketofen or ketoprofen. And then the final group had both. So they had a trim, they had a block, and they had pain relief. And what they did is they followed these animals through for the next few weeks, and they scored them 5 to 6 weeks later. If they had blocks, they took the blocks off to make it all nice and even. And then they assessed whether they were sound again. So sound being a score 0 or a 1. So remember, these were animals that had been lame for less than 2 weeks based on those mobility scores. So they'd been sound at the fortnightly mobility scores, and then they became lame. So where the cows just got a therapeutic trim, 5 to 6 weeks later, just under 70% of them were walking sound again. If they had a block, this increased only slightly, and that was quite interesting for me because we've been blocking cows for decades, and you would think actually that you get better than a 3% increase in your success rate. When they gave them pain relief rather than a block, actually the success rate was slightly higher, and they think this is sort of led on now to the next thinking, is that perhaps we need to be giving more animals pain relief at these early stages. And there's a 3-year study just on giving new cases of lameness pain relief that's just finishing now at Nottingham University, and I think those results are going to be really, really exciting. So hopefully a few months' time I might be able to share some of those with you. Then they looked at the trim, block and pain relief group, and they found that the success rates were even higher still. So 85% of the animals that received this treatment were sound 5 to 6 weeks later. Now, when we do analysis, we're looking for statistical significance, and actually this was the only group that had a statistically significant higher success rate. So we were able to say that if you trim, block and give pain relief, you are significantly more likely to successfully treat or have a successful outcome being a non-lame cow 5 to 6 weeks after treatment. And that was really groundbreaking research because we'd hardly had any studies done on treatment before, and lots of people trying different things, but really this was really useful information because we can improve our success rate by around 15% based on a trim alone, just by giving trim, block and pain relief. And that hugely increased as well, because these cows are just not going to be as lame as much. So that was great. So if we pick up these cows within them being within 2 weeks of them becoming lame, so that answers our question of how often should we be scoring. Well, this indicates, I think, that we should be scoring every 2 weeks to pick up those new cases. And it also answers the question as to what we should be treating these cows with. So we should be treating them with trim, block and pain relief. What happens if we actually left these animals for a little bit longer? So I know some people advocate scoring every 6 weeks. Well, what happens in that scenario? Well, actually a very, very different picture is painted. So they repeated this study, but with animals that had been lame for at least 6 weeks. And actually when studies have been done by Bristol University in the past, they found that if we're not doing mobility scoring, but we're just relying on other indicators of a cow being lame, such as cows coming in more slowly from the field, or coming in more slowly to the parlour, or just noticing them in your normal stockmanship during the day, that we actually have a delay of about 6 weeks of them being picked up. So I suppose this is showing the difference between your early intervention through your mobility scoring and what we would normally consider our lameness detection. So the results that they had from this study, where their cows had been lame for more than 6 weeks, was very, very different. So across all of the groups, they were getting no more than 15% of animals sound 5 to 6 weeks later. And that is a phenomenal difference just for delaying treatment by 2 to 4 weeks. And this is why it's important when you start picking up new cases of lameness that we still target the correct cows. We want the cows as early as possible, because by the time we get a few more weeks down the line, we've got more inflammation there, we've got more damage to the foot, and we're much, much less likely to get a successful outcome. But for me, it's also really, really important how we actually go about blocking these animals. So I'll just discuss some of my sort of tips for blocking animals correctly, because I've sort of glibly said trim, block and pain relief, but you can put a block on many different ways. But and I always get asked, what's my favourite block? Well, my favourite block is the one that gets put on correctly. So what do I mean correctly? Well, I want the correct length block. So I want a block that is coming right to the back of the heel, so it's protecting the heel. In photograph A, you can see that the heel is standing proud of the block there. So when the animal puts her foot on the floor, she's going to go down heel first, and she's going to rock off the back of that block. Remember, these blocks are on there for about 5 to 6 weeks. During that time, the foot is going to grow around 3 centimetres, so that cow is going to slide backwards off that block. So we want a block that's going to give good coverage of the foot. So it needs to come back and completely protect that heel. The other thing it needs to do is that it needs to be put on correctly. And this is a common problem that I see. So here we have photograph A on the left-hand side. This was a block that had actually been put on by a trimmer. So the farmer had paid £10 for a trim, £12 for a block, and the cow was still laying some time later. And you can see here that the block is completely angled. So we're looking here down from the heels, from the heel bulbs down towards the toe. And you can see we've got a green shoe on there that is angled in towards the foot. So you can see when that animal walks, she's still going to be putting weight on that outside claw, which is the problem claw. So that's why she's still lame, because actually the block hasn't achieved what we want it to achieve. So when we're putting a block on, I want the bottom of the block to be at a 90-degree angle to the bone in the leg. So if you imagine the bone is that vertical dashed line coming down the leg, and then we've got a 90-degree angle with the bottom of the block. And that means that we're going to have a really good amount of rest when that cow is walking. And I can just show you an example of the good and the bad in this next photograph. I took this after a cow came out of a crush at a conference in America that I was speaking at, and these were the blocking demonstrations. So these were put on by the people that had been making these blocks, so they should be put on as best as we can. And you can see here on the left hand side that cow is still taking a lot of weight through that outside claw. That outside claw was the one that was bruised, so we're not going to be getting the success that we should. On the right hand side, hopefully you can see there that we've got a gap between the ground and the outside claw heel. And that's what we want to be seeing, because the purpose of the block is basically like a crutch, so that it should be taking the weight of the cow through the block rather than taking it through the diseased claw. So really important that we put our blocks on correctly. And the other thing is that it's really important also that we trim out these lesions correctly as well. So we need to be removing all of the underrun horn from around the lesion and making sure that it's really, really nice and supple. So there's a white line that I've treated on the left-hand side there. You can see I've removed around a couple of centimetres right away around that lesion, because then it means as the cow walks, we haven't got any hard edges of horn pushing on that exposed corym or quick underneath. And when we get those horrible sort of granulated lesions that come out from the foot, that's basically because of irritation. And you can see we've just got a mild sole ulcer on the right there. And again, I've trimmed it right out. So it's all really nice and supple, really nice and thin horn all the way around that lesion. So that's how we want to be treating claw horn lesions. So anything with bruising, white line or sole ulcer, they need to be getting a block put on correctly. They need to be getting pain relief, so 3 days of pain relief. Have a chat with your vet about which one's most appropriate for your farm. And we need to be trimming out these lesions correctly too. So that's those, but what about DD? Now, we will be doing a workshop on DD, and we will be exploring some of the treatment options in more detail. But there are loads and loads of treatments out there for DD, lots of which claim to cure DD and lots which claim to be the silver bullet. But in reality, by the time we get a cow with DD at this stage, we're probably not going to cure her because of the way that DD works, and it burrows deep within the skin and it sits there and it insists. So when it comes to treating DD, actually the best practice method is still our trusted blue spray. So in terms of gold standard approach, if we had a lesion like this, we pick her up in the crush. Ideally, we would trim the foot as well. We didn't, this is actually part of a study where we didn't trim the feet, we just treated the DD, but ideally we pick her up, we clean off the lesion like I am there. So wash it just with clean water, just to get rid of some of the debris on the surface and any slurry that's there. Dry it really thoroughly, clean out the interdigital space as well. Give it a good spray. So a licensed topical spray such as engamycin, alleamycin, all have the same active ingredient in them and work well on these lesions. We need to leave it for dry for 30 seconds. I tend to trim the foot while I'm letting it dry and then come back and give it another good spray. Typically, these animals need between 3 and 5 days of treatment. So just like a case of mastitis, you wouldn't tube them once and leave them. We need to follow it up. So 3 to 5 days is what I typically find that we need to treat these animals for. And what we're looking for in terms of a successful outcome is actually a black, thick scab that's formed over the lesion that isn't painful anymore when when you push on it. So that's just sort of a brief overview of really sort of the best practice approach to treating the most common lesions that we see on farm. So we've talked about improving recognition, we've talked about improving treatment, but obviously we want to stop these cows going lame in the first place. Our time is much, much better spent doing prevention rather than cure. So how do we prevent these cases of lameness? Well, again, I've just got another quick question for you, and that is what the most common cause of lameness. So what's the most common lesion that you find causing lameness on your farm? Is it bruising? Is it sole ulcer? Is it white line? Is it digital dermatitis? Or is it something else? So what's the most common thing that you find on the cow's feet when you've got a lame cow, you pick them up and you treat them? Okay, I'll just give the final few a couple of seconds to vote. Okay, so we've got 40% of you saying sole ulcer, 40% saying white line, and 20 saying digital dermatitis. And those, without doubt, are the top 3 that come out time and time again as the most common causes that we see for lameness. So it's really, really important that you know what the main cause of lameness is, because they've all got different risk factors. When it comes to digital dermatitis, this is a bacterial cause. So it's bacteria that's causing the digital dermatitis. Whereas when we're talking about sole ulcers and white line disease, they're due to mechanical. So they're not actually caused by bacteria, they're not caused by infections. It's due to mechanical problems that we get those. So if we start thinking about how we stop these happening in the first place, then when we talk about preventing lameness, we talk about the 4 success factors. These are 4 success factors that are part of the AHDB Healthy Feet programme, and they're the 4 things that we really need to get right to bring down our lameness and make sure we have low levels of lameness in the herd. So these are the 4 success factors here. We've got low infection pressure to start off with, and that's focused on hygiene, biosecurity, and foot bathing. Our second success factor is good hoof shape, horn quality, and digital cushion. Now, we've actually renamed this recently into the robust foot, because basically this is all about having a robust foot. If you've got a robust foot, it's going to be better able to cope with everything else that it has to come across in the environment. So in terms of robust foot, we're talking about genetics, we're talking about nutrition. Now, nutrition gets blamed an awful lot for lameness, but although it is important, particularly in creating a robust foot, a lot of the links that we had there originally, where we thought that maybe acidosis or subacute acidosis cause bruising and ulcers, actually a lot of those theories have now been debunked. They're now myths. So nutrition is important, but it's actually more sort of indirect effects of nutrition. Foot trimming comes in here, absolutely crucial. Then body condition scores as well. Are these cows losing too much condition around calving? If they are, it actually exposes the foot to more problems with lameness than if they're maintaining body condition. And then of course moisture, because the cow's hoof will absorb moisture. So if they're in a very moist environment, just like yourself, if you spend hours in the bath, your nails go softer because they're absorbing moisture. The same with foot bathing animals through formalin really, really regularly. That just dehydrates the foot. That's actually the only mechanism by which it strengthens the foot, just through dehydration. So we need to make sure that the feet don't get too dry and brittle, but we also need to make sure that they don't get too moist, because then they get softer and then they're more exposed to problems. So the third, we've just gone slightly out of sequence here, but so I'll go from 2 to 4. So success factor 4 is low forces on the feet, and this encompasses an awful lot that happens in the cow's environment. So this encompasses good cow comfort and also good cow flow. So good cow comfort relating to housing, relating to time budgets, good cow flow relating to stockmanship, floor surfaces and tracks. And then we come on to success factor 3, which is our early detection and prompt effective treatment. And this, of course, relates to mobility scoring. Are we picking up cows at an early enough stage? It comes down to time management as well, trimming protocols, training. Is everybody who's picked up a cow's foot, have they been trained in what they should and also what they shouldn't do? And then also, have we got the right equipment to make it easy? We always say one person should be able to get one cow in the crush within 1 minute. It's quite a tough challenge, but it is doable. So in terms of, regardless of what your cause of lameness is, so you all had either white line, sole ulcer or DD as the main cause of lameness on your farm. Well, both of these success factors, 2 and 3, relate to all types of lameness, because regardless of the cause of lameness, we've got to have our early detection and prompt effective treatment in place, and we've got to create the most robust foot that we can. So we've talked about early detection and prompt effective treatment. So now I'm just going to cover off trimming, because it is a topic that I think is really, really important. And one of the reasons I got so involved in trimming a few years ago was because I was finding that clients were doing an awful lot to try and improve the situation on the farm. But because some of the things with the trimming weren't quite right, we weren't getting the results that we need. And obviously there's no point in detecting your animals early enough when they go lame. We've got to be making sure that our trimming is up to scratch as well. So just a few sort of quick do's and don'ts when it comes to preventative trimming. So this is trimming in the absence of lameness. So this is basically your dry off trims, or it might be your early lactation trims as well, to prevent them going lame later on. So this is what I don't want to see. I don't want to see removal of the weight bearing. I've got axial and abaxial walls here. This basically means the inside or the outside walls of the foot. So this is around the outside of the claw, because the wall of the foot is the strongest part of the foot. That's where the animal's actually being bred to bear weight. That is really, really strong. If we start tidying that up with the grinder, smoothing it out like we've got in this photograph here, all we're actually going to do is actually remove some of that weight bearing structure and put it onto the sole, which is exactly what we don't want. So I never like to see the grinder going between the claws at all. We also don't want to remove too much off that inside claw heel. So we've got a very white foot here, and you can use all the anecdotes like we're not peeling potatoes, we're trimming feet, etc. But the more we take off that inside claw, particularly in the heel region, the more we're going to start rocking that cow back, and her weight's going to go back through her heels, which is exactly where we don't want it to go. We want it to be shifted forward into the toes, because that's the most stable area of the foot. The other thing I don't want to see is sloping inwards of the soles. So you remember that block that I showed you that had been put on incorrectly? That was because the soles underneath had been sloped so much that when the block went on, it too was sloping. We need to have flat, perpendicular soles at the toe, and we need to have balanced heels at the back of the foot as well. So I've got now on the right hand side what I would consider to be a really well trimmed foot. And the reasons for this are we've preserved all of the strong weight bearing inside and outside walls. So that cow has been left with all the things that she needs to walk on in terms of those walls. We haven't tidied them up. Even if we've got curled toes, we still leave them, because if we start taking the grinder between the claws, then what happens is we just end up with a foot that becomes splayed and really deformed. We've preserved the inside claw heel here. So the claw on the right is the inside claw, and the claw on the left that's whiter is the outside claw. So remember, the problems we get mostly on the outside claw, that's where you're going to mostly see white lines, sole ulcer and bruising. So we want to shift as much weight to the inside claw as possible. So he hasn't touched the back of the foot there at all. So we're just tipping the cow's weight forward into the front of the foot. And then also what he's done here is he's done a very small model on the inside claw to preserve as much weight-bearing area there, but taken a wider, deeper model from that outside claw. And this is actually one of the things that I'm going to be exploring further in my PhD research, because we know that that reduces the risk of lameness. Some research from the States has shown that. But I want to start actually looking at and quantifying actually how wide we should take our model and how deep we should take it too. So those are just some pointers of things that I definitely don't want to see on a foot and things that I do want to see on a foot. And it's always really important when you've got anybody that's trimming on your farm that they are qualified and they are also checked to make sure they stay up with the latest evidence base for trimming. So before I get too off on a tangent, I'll carry on and we'll talk now about success factor 1, which was in relation to digital dermatitis. So if you've got digital dermatitis on your farm, there's no point in starting to look at how you can improve cow comfort, cow flow. Yes, they're important, but actually we need to focus on success factor 1 first, which is our lower infection pressure, because that's actually going to get us the biggest returns. Because remember, we have only got a certain amount of resources to put into this. We've got to make sure that we get the maximum return on investment. So I said low infection pressure is all related to hygiene, biosecurity and foot bathing. So, again, just come out of sequence. So things to consider if you've got digital dermatitis. Firstly, is your biosecurity up to scratch? Now, I know we talk about biosecurity constantly, but it is really, really important. There are really few herds across the UK that don't have DD. I would probably estimate at less than 3% of herds don't have any DD. Now, obviously, they need to do absolutely everything they can do to keep it out. So if you don't have DD, make sure that everybody coming onto your farm is absolutely disinfected and everybody is coming on clean. And that's people, it's contractors. And certainly if you're buying in animals, that's a real risk factor for bringing in DD as well. Even if you've got DD, and you're buying in animals, then there is the risk that you could actually bring in another strain. There are 3 different strains of digital dermatitis. Sometimes we hear that someone's brought in some heifers and they see the DD flare up. And that could be because the heifers have brought in a different strain. So we need to think about biosecurity between farms, but also within your farm as well. So for instance, if you've got heifers that don't have DD, so if you're negative in your young stock but positive for DD in your cows, just think about potential ways that we can start reducing the risk of those animals passing it from one group to the next. So for instance, a real risk time would be TB testing. If you've got the heifers coming through a collecting area or handling system that the cows have been through, that's again a real risk. So maybe do the heifers first if you can, or clean down, disinfect the area before you bring the heifers up, or run them through a foot bath on the way out. So just think about ways that you can reduce the risk and improve biosecurity between groups on your own farm. Then we need to think about whether we're catching lesions early enough and treating them appropriately. So when I say catching them early enough, we talked a lot about mobility scoring, but unfortunately DD is not very, not all cows with DD will actually be lame. I find roughly around 1 in 2 cows, so 50% of cows. So if we only go off mobility scoring, we're probably going to miss half of the cows in the herd that have DD. So we need to be looking really at things like parlour scoring here, so washing off the feet and having a look for lesions in the parlour. And again, we'll talk a lot more about doing that practically when we come on to the digital dermatitis workshop. Another big thing to focus on if DD is your biggest cause of lameness on your farm is your foot bath. So the foot bath is really, really important in prevention. So if you're great at treatment, but you haven't got foot bathing up to scratch, then what you'll find is we keep going through this cycle of infection when it comes to DD. So we need to go through a full foot bath appraisal. So are the cows getting enough dunks, the hind feet? We're aiming for at least 3. So we need a foot bath at least 3.7 to 4 meters long, depending on how big your cows are. Are they going through it enough? Is it clean enough? Have we got the right concentration of liquid of chemical going in enough? And where is it positioned? Are we getting good cow flow, or the cows mucking in it? How is it designed? So all of those things are really important to consider, because again, foot bathing is costing us time, it's costing us energy, and it's a real faff sometimes to empty them. It's a horrible, dirty job. So how do we make it easy for you? How do we make it easy for the cows and get the results that we want? And then finally, we need to start thinking about hygiene as well. How can we make these cows as clean as possible? There's typically only 1 or 2 places on the farm that you might be spreading DD from, and we can't necessarily pinpoint where that is. So we need to just make sure that everywhere on the farm is as hygienic as possible. So when we're looking at scrapers, is it a case not so much of how often they go off, but when they go off? Do they go off at times of lowest cow traffic, etc.? So these are all of the things that we need to be thinking about when it comes to DD. But if you were one of those who said that digital dermatitis was your main issue, it's great, because we can solve that. We can get on top of it and control it for the long term within a week. So if DD is your main issue, please join us for the workshop in the next couple of weeks, because we will tackle, we will go through the plan that will help you tackle it and get on top of it once and for all. So that's just a little snapshot of the things that you need to be thinking about when it comes to DD. But what about white line? So when you, sorry, we've got a sole ulcer here. What about sole ulcer? So when it comes to sole ulcers, think about standing up. So sole ulcer is a standing up disease. So this is really important when it comes to cow comfort. So how often are the cows lying down a day? Our target time budget for a cow for lying down is 12 to 14 hours, but actually a lot of farms we're just not getting that amount of lying time. There can be a lot of reasons for that. So if sole ulcers are your main issue, then we really need to look at your cow's day. Are they being given the opportunity to lie down enough, or are they being given the opportunity to lie down enough but just don't want to lie down because it's not comfortable enough? So there are 2 differences there, and that's where we need to start looking at time budgets. We need to start thinking about ways that we can basically improve our lying time as much as possible. For every hour over 8 hours of lying time, you get an extra litre in the tank. So it's really, really important that we try to maximise that. And that, you know, this goes, the benefits of improving cow comfort and lying time go way beyond just lameness. So we need to start looking at milking times. Are our milking times too long? So if you're milking twice a day, we don't want milking to be longer than an hour for any group. And that's from the cow leaving the shed to the last cow coming back into the shed. So it's sometimes looking at how we can split groups, or how we can just make it easier so the cows aren't standing up in the collecting yard for too long. For a 3 times a day herd, we want to be looking at milking times of 45 minutes. Then we need to be thinking about, is her bed comfortable enough? If you think that times a day, so if there's anything that just makes them a little bit hesitant, then it's going to impact on their lying time. The next thing we need to think about is body condition score. So we'll talk about this when we come on to the sole ulcer workshop, but the fat pad in the foot itself is linked to body condition score. So we know that cows that lose a lot of body condition after calving, or cows that are very thin, are more likely to go lame. And this is sort of does a thin cow go lame, or does a lame cow go thin? And both actually happen. So we know that cows that are lame aren't going to eat as much. They lose some of that body condition score. They get thin, they have a thin fat pad, and it doesn't protect the foot, and they're more likely to go lame again and again. And similarly, a thin cow doesn't have that protection. So around calving, she doesn't have that protection from the pedal bone dropping and sole ulcer or bruising happening. So lots to consider there. There are things that we need to look at in terms of how we house our transition cows. They're really important to get them off their feet as much as possible. And monitoring body condition, we can start trying to target those animals that might be at increased risk of lameness, and therefore make sure that we trim them appropriately. Again, with sole ulcers, if we're picking up cows as lame and we're seeing sole ulcers, we're probably about 6 or 7 weeks too late, because it takes quite a few months from when the first insult happened and that sole ulcer started developing till we actually see it on the sole. So what we're really aiming for is to pick up these cows early enough before that sole ulcer happens, because by the time she's got a sole ulcer, we've probably got damage in the bone underneath, and she's going to get one again and again. So we need to move towards really bruising being our main problem, because that indicates that we're identifying these cows early enough. And finally, is the trimming regime getting the results it should? So like I said when we were discussing trimming on a few slides ago, We know that cows that have that bigger, deeper, wider model on the outside claw are less likely to get a sole ulcer and bruising. So are we getting the results that we want? Are we seeing a reduced number of sole ulcers after these cows have been trimmed? So monitoring records, really important, and making sure that when we're trimming, we're not doing anything that's going to be detrimental and actually increase our risk of bruising and potentially ulceration too. So you can see there's lots and lots to consider, and again we'll come into these in more detail in the individual workshops so that we can give you some pointers about how you can maybe change your cubicles to improve line time, and also all the different options out there, and maybe which work well and which sometimes have some challenges too. So finally, moving on then to white line disease. So again, this is all centered around success factor 4, but it's actually the other half of success factor 4. So sole ulcers were to do with cow comfort, whereas white line is to do with good cow flow. So this is where it's our walkways, it's our tracks, it's our floor surfaces, but also how cows move around the farm. So if we've got lots and lots of cow on cow interaction, or we've got lots of tight turns, we've got lots of tight twisting and things like that, we're going to increase our risk of white line. So W for white line, think about walkways and surfaces. So things that we need to look at: what are the obstacles that we're putting in the cow's way? So if you're bringing them in from the field, have we got tracks that go narrow, then wider again? That's going to all force cows to push and shove through. Have we got grids in the way? Have we got dark areas where they're going to try and avoid or try and shove each other a little bit more? What are the obstacles we're putting in the way of these cows? Are the floor surfaces and tracks up to the job? Are they slippy? Could you trust yourself to run and then try and stop without falling over? Grooving is really, really important, but we need to get it right. There are some grooves that could potentially increase our risk of white line and things like that if they're not creating enough of the grip. I've got a photograph here of what would be my optimal grooving pattern to make sure that the cows are, however they're stood, they're always on a groove and they're always going to get that protection. Tracks the same. We don't want to be sharing tracks with cows and machinery. We need to have separate tracks for the cows. They need to be wide enough. They need to be made up of the correct material to make sure we don't get poaching and stones and things like that that can exacerbate white line. Same as with sole ulcer, body condition score can influence white line as well. So again, if they lose too much body condition score around calving, it can increase our risk of white line. So if you see a spike in white line around 60, 70, 80 days after calving, that can indicate that management around calving is a predisposing factor. Whereas if you see white line throughout lactation, that possibly points more towards things like your cow flow and your tracks and surfaces being a problem. Are cows being handled correctly? If we're pushing cows, if we're shoving cows, if we're rushing cows, it's going to force them all to walk with their heads up. And then it means that they're walking too fast and they can't put their feet where they want to. Cows will handle stony tracks, cows will handle broken concrete really, really well if they're given the time to pick their way through. So as soon as we start rushing cows, pushing cows, that's when we're going to increase our risk of white line. And again, it comes back to trimming. Trimming is really important because, again, we've got a good, robust foot and we're getting the right results from our trimming, then they're going to be able to withstand more of these challenges that they have in their environment. So I know we're just coming up to time, so I can just finish and try and pull all of that together. You can see it's a real sort of overview. I could talk literally for weeks about lameness and all of the different aspects and delve into it in a lot of detail, but hopefully that's just given you some food for thought tonight. So some of my take-home points would be: improved detection. Are you picking up cows early enough? We want to be picking cows up when we're just starting to see bruising, when we're just starting to get a reaction on the foot. Which indicates that we've probably just got the start of bruising, because that's when we're going to get our maximum benefit and our best success rates from treatment. Follow the science when it comes to improving treatment. So block cows, give them pain relief, and also trim them correctly as well. When it comes to DD, we still don't have the evidence that anything is better than the topical blue spray. Identify the key causes of lameness in your herd and then target the risk factors. So if it's digital dermatitis, look at hygiene and foot bathing. If it's sole ulcers, look at cow comfort. And if it's white line disease, then cow flow and flooring are the things to look at. And this is really, really important, because if you've got sole ulcers as your main issue, don't go and spend thousands and thousands of pounds on an automatic foot bath. Put your money into mattresses and cubicles. That's where you're going to get the biggest return. And sole ulcers are actually the most costly lesion that we see. So this is where we get a huge return on investment from making some of those changes. So hopefully that's just given you some food for thought. I'm really happy to take any questions that you've got, just want to say thank you very much for all tuning in tonight. As I mentioned, we have got some workshops focused on the individual lesions later on. So in a couple of weeks' time, on the 14th, same time, 8 p.m. We've got one on sole ulcers. So we'll be talking a lot about cubicle dimensions, cubicle comfort, design, things that you can do to your own cubicles just to improve our cow comfort. And then on the 16th of September, again at 8 o'clock, we'll be going into digital dermatitis in a lot of detail as well. So thank you very much.
Brilliant. So thank you very much, Sarah. And yeah, again, as you mentioned, you know, it's great to hear that snapshots. And as you mentioned, you probably could be here for quite some time talking about everything all together. But yeah, thank you very much for that that snapshot. We have had a few questions in, so I'll quickly whiz through those once I get them. So first of all, would spraying a product on hoofs in the parlour be effective if you don't have location for a foot bath?
Yeah, that's a really good question. So as I said, your foot bath is doing the prevention. So effectively just washing off the feet the whole time. We know that just by washing off the feet with water that we'll get some benefit from doing that, because we're keeping the feet clean. In terms of products, my only concern about spraying chemicals in the parlour is that obviously we've got inhalation and things like that. So I'd never spray formalin or anything like that in the parlour. There are some products out there, some commercial products that are have been designed for use in the parlour, but I'm a bit dubious of some of the results that they've been getting. All I'd say is there's only one farm that I've ever been to, and it was a Farming Connect farm in North Wales, where we were really stumped as to what we were going to do with a foot bath. So I'd say is send in some photos of your setup if you'd like, so we can have a chat about where you could potentially put a foot bath, because I think that's really where we get the best results.
Yeah, brilliant, thank you. What material of block do you feel works best for Lameness treatment?
Yeah, so I use wooden blocks, so a good size wooden block, but if I've got a lesion that's going to take a little bit longer to heal, then I'll probably use a non-wearing plastic block. But again, it's the placement of the block that's really important. If you've got a sand farm with high wear, then I wouldn't use a wooden block, because they just get ground down within a couple of weeks.
Yeah. Would applying copper sulfate or iodine paste and the bandage allow you to treat a digital dermatitis case and not have to revisit the foot as the active ingredient is kept on the digital dermatitis wound?
Yeah, so that's a good question, and that's a topic that I could have gone on for hours tonight. Now, if we're using a copper sulfate paste, that's really, really irritant on the skin of the foot. It's really irritant on the lesion, and there's some thoughts that it could actually drive more DD deeper into the foot. So I wouldn't use copper sulfate on the lesion, and the same with an iodine paste. Again, there's limited evidence out there, and I think if we're using it neat specifically, then it can cause pain as well. You can treat cows in the parlour with spray as well. So if you've got them coming in for milking, it's the easiest thing is just to keep them open. The other thing about bandaging, and I am quite opinionated on this, is that they add a lot of cost for not really any benefit. So the studies that have been done looking at bandaging actually show that within sort of 24 hours, you've got a huge moisture content in that bandage, which is just what we don't want on the foot. And when they've done studies to actually try and create DD in the lab, they've had to bandage the feet. So for me, it's sort of counterintuitive. So again, I'd want to know what restrictions there are on treating these animals. And so, for instance, like a robot herd, if you get her in the crush one day, you could potentially just spray her in the cubicles the next. But I'm not a fan of bandages or any caustic treatments.
Yeah. What is the best material to use on cow tracks to prevent bad feet? AstroTurf, shale or bark?
Yep, so it's there's lots of really good materials out there. Sleepers, if you can get them, work really well, as long as you don't get too many stones building up on them and things. A limestone dust topping is very good, but again, you've got to really compact the chippings underneath down. Bark, I find, can actually increase your risk of problems. So anything that is got the potential to go up between the claws and cause damage between the claws can increase your risk of things like foul and things like that. AstroTurf was mentioned. That's really nice on a really well compacted track. The cows seem to be really happy walking on that. Sometimes it can get slippy, so you've got to make sure that you keep enough sand on it. In terms of shale, again, if you've got sharp shale, that can increase the risk as well. For information on tracks, I would look at Dairy New Zealand website, because they've got some fantastic information on what does and doesn't work.
No, brilliant. And I think this is the last question we've had through on Zoom tonight. So what do you think about using biotin to reduce lameness?
Yeah, so that's a great question. So that comes into our sort of our robust foot, and we need cows to have enough biotin, but it tends to be associated a lot with white line. So lots of people would say that if you've got a white line issue, feed biotin, but I would first be looking at the other causes, potential causes of white line. So have we got twists and turns? Have we got poor floor surfaces? Because no amount of biotin is going to overcome some of those challenges. So if you've got everything absolutely spot on and right, and we're still getting some white line, that's where I might look at supplementation. But it's quite costly. You don't see the results for quite a few months. And recently, through the pandemic, the prices have been really skyrocketed as well. So it's sort of an individual farm basis. I never use it as a blank recommendation, but it can be useful in some circumstances.
Yeah, no, brilliant. Well, thank you very much, Sarah, for answering all the questions. Felly, cyn I mi gloi, hoffwn ni ddiolch i gyd am ymuno yn ei heno. Diolch i Sarah am ei chyflwyniad, a hoffwn ni eich annog i lenwi'r ffurflen werthuso ar ddiwedd y webinar os modd. Before I close for tonight, I'd just like to thank you all for joining, and thank you, Sarah, for your informative presentation. And can I also take the time to encourage you all to fill in the feedback form at the end, and it should pop up at the end of the webinar. Diolch yn fawr a nos da i chi gyd. So thank you and good night.